Well, safety's definitely increased since we started it. The level of communication starting the case has become a lot better, which enables everybody in the operating room to be an active participant in the patient's safeties. So it's definitely been an improvement.
It means a lot because you open the team to more communication. You have the surgeon and the staff, they all identify their roles, and so it lets everyone know that they're vital in the whole operation of the surgery to get the patient safely and effectively off the table.
I'd have to say the thing that I am the most proud of is the cooperation that I've seen amongst the different disciplines in the operating room to make patient safety a high priority, the highest.
The Dialysis Access Institute is so incredibly busy that any steps to make safety a priority is always considered paramount. Also, all of our operations are sided, left side, right side, legs and arms. Therefore, doing a timeout and having a checklist and doing anything that we can to make the surgery as safe as possible is always felt to be a very good idea.
The timeout has been great, because basically when the patient comes in for surgery, their anxiety level is very high, and pre-op is very busy, and they deal with a lot of staff coming in and out, as far as the doctors, the nurses, the CRNAs. So sometimes the patients get very overwhelmed, and they may forget their allergies. And when we do that second timeout in the back, you know, that's when we catch a lot of things, because they'll be like, oh, I'm allergic to this, but then it's not on the chart because they were so nervous up front, they forgot to tell us. So that second time out is awesome because we have caught a lot of mishaps from the patients just forgetting.
The point is that safety features take a lot more time, but if it can save one life, if it can take a burden off one family by us doing the right thing, then we've done what we need to do.
The safe surgery checklist is important because our patients aren't always upfront about their NPO status, and so if the first time you ask them, they may tell you that they haven't eaten, and the second time that you ask them, you get to the truth of the situation and you find out that they may have cheated a little bit and had some coffee.
The surgical safety checklist ensures that we do the correct surgery on the correct patient on the correct limb every time.
The culture of the operating room is changed in the fact that everybody's on the same page now. There's no question about what we need to be doing prior to surgery. I think prior to really looking into this, everyone was just kind of starting cases, saying, okay, this is such and such, and we're doing such and such, okay. But now everyone has a rhythm to what we're doing prior to starting cases, and every nurse is on the same page, and every person in the room knows that they have their part to say.
So it's greatly improved the outcome for surgery in the operating room.
So the safe surgery checklist for our organization, I think, is probably best summarized from my perspective as being surgeon-directed. The surgeon is in control and sort of runs the checklist aspect of the case prior to the initiation. And then again, at the end of it, I believe the debriefing component of it helps ensure those items that were deficient during the case are rectified prior to the next operation, and those things that actually went quite well are encouraged and spread throughout the operating room environment to improve overall patient safety.